Hi everyone, I'm Dr. Karen Sheffield-Abdullah, and I'd like to talk to you today about mindfulness. I am a nurse midwife, I'm a mother of four, and I am a mindfulness instructor, and I practice mindfulness, and I'm also a researcher. And I really want to take a moment to invite us to think about how we might be able to apply some of the mindfulness practices that I'll share with you to the time during pregnancy, and in particular during the postpartum period. And so, when we talk about mindfulness, it's important for us to talk about the definition. And the definition that I use by John Kabat-Zinn states that mindfulness is about paying attention in a particular way, on purpose, in the present moment, to what is actually happening, and doing that in a non judgmental way. And there is something called the 7 pillars of mindfulness. You'll also hear them called the 7 attitudes of mindfulness. And that includes non-judging. You may think that there's, a certain type of person that practices mindfulness, or you have to look a certain way, or sit a certain way. And there is no judgment here. You arrive authentically as who you are, and you think about how you may be able to apply it to your life. Another pillar of mindfulness is called patience. Having patience with ourselves. We don't have to be perfect. You don't have to get everything right. But having patience with yourself, especially during the postpartum period, when there are so many different demands on your time, on your body, as you're making adjustments from pregnancy to the postpartum period, being patient. Having a beginner's mind is another concept, another pillar. And the idea behind the beginner's mind, if you can imagine kind of looking at your life as a laboratory and investigating, thinking about how you might approach experiences that you have, what's here in this present moment, as if it's the first time that you're seeing it. We also talk about trust. Trust in what you know to be true for you. Trust in your body and your body's ability. Advocating for yourself. Listening to what your body is telling you. Non-striving is another important pillar. We're not striving to achieve a certain thing within mindfulness. We're not trying to achieve calmness or achieve a certain state of being. It's really about being present in the moment, present moment awareness. Another pillar is acceptance. Acceptance of what is here, whether we like it or not, whether it's wanted or not, pleasant or unpleasant. It's acceptance of what is here now, and then how do we move forward? And lastly, we think about letting go. Letting go of that which no longer serves us. So that we can be our full and authentic selves. So we've talked about what mindfulness is, but let's also take a moment to talk about what mindfulness is not. Mindfulness is not religious or spiritual. It's not a magic bullet. It's not always about feeling good. It can reduce stress, but it's not about stress reduction. It's not about being calm. You may achieve calmness through practicing mindfulness, but it's not about striving to be calm, right? And it's not about being complacent. Some of the usefulness of mindfulness is increased energy, better communication, increased or better concentration, and self-care, prioritizing yourself, which is so important during the postpartum period. And as we think about the research that surrounds mindfulness that's been done over several decades, we know that mindfulness can help to decrease anxiety symptoms, decrease depressive symptoms, decrease stress, and decrease pain. And so with that in mind, what I'd like to do is take you through a brief mindfulness meditation or a sitting meditation, and inviting you now to find a space where you can be quiet, where you can be still. And coming into a position, whether it's sitting or lying down, you can be on a chair, you can be on a yoga mat, you can be on a cushion. But finding a position that best supports your body and supports calm, alert awareness. Inviting you to close your eyes now if you feel comfortable doing so. If you don't want to close your eyes, just simply adopting a gentle downward gaze or looking down, perhaps at 5 or 6 feet in front of you at nothing in particular. And noticing what's here. Noticing the breath. Perhaps noticing the quality of the air, cool or warm. As you inhale and the air enters in through your nostrils, and exhale through your mouth. Noticing the rise and fall of the chest. Noticing the cadence and the pace of the breath. No need to fix or alter, just noticing what's here. Noticing the felt sense of the body in your chair or on your cushion or your mat. The weight of the body and the support beneath you. The felt sense of the feet grounded to the earth beneath you and the floor. And taking a moment to notice any areas in the body where you may be feeling tension, unease, and attending to that area carefully and thoughtfully. Consider bringing a softening or a soothing to that area. And if you find that your mind has wandered, as the mind does, just gently bringing your thoughts back to this present moment, a moment that you will not experience again. And bringing an awareness to the felt sense in the body. And as we bring this brief practice to an end, you're going to hear the sound of a bell shortly. And when you hear the sound of this bell, I invite you to open your eyes at your own time and at your own pace. So, as we end this brief introduction to mindfulness, just inviting you to take a moment now to think about what's here, what's come up, what's present. And I look forward to seeing you on some of the other videos that will be made available on this website. It's been a pleasure.